I am Dr.Abha Majumdar and I have been working with the IVF department of Sir Gangaram Hospital since its inception in 1990. I have been the director of the same department since 2009. See, IVF, as the word goes, is in vitro fertilization. Normal natural fertilization happens inside the body, which is known as in vivo. So IVF means when we bring the gametes, the male and female gametes, outside the body and then make an embryo by combining the male and female gamete, then this is known as IVF. Well, in women who are around 40 and are undergoing IVF, I think in today's world, what we can do for them is do a pre-implantation genetic screening of the embryo so that we can select out a euploid embryo, and then they have an equal chance to younger women of getting pregnant with these embryos. Okay, tubal blocks could happen generally due to infections, but also they could happen because of surgery, that is sterilization operation. And blocks could be in the proximal part, in the middle part, in the distal part of the tube. The distal blocks can be opened up by laparoscopy. The proximal blocks also are opened up today hysteroscopically, where cannulation is done of this proximal part and we put in a laparoscope to see whether the tube has been opened by cannulation or not. Middle part blocks are difficult to treat, and they generally require reconstructive surgery where we may use magnification, do it under microscope or do it under naked eye, or even use a loop which has some magnification of say 4 times or 2 times also. Here what we do is remove the blocked area, make sure that the two ends are patent, and then we combine the two. This is most commonly done when sterilization reversal is desired. So this is what we do for tubal blocks, and those blocks which are not amenable to surgery, we need to do IVF for them. And in fact, IVF has become the most important technique used for patients who have irreversible tubal blocks. Well, the options with blocked tube is either you open them surgically, and if you can't do that, then you have to bypass the tubes and go in for IVF. Well, ovulation induction for IUI and ovulation induction for IVF, there are two basic differences in these two. For IUI, our aim is not to produce more than 2 to 3 follicles, whereas for IVF, we want to produce 10, 12 follicles at least, so that we could recover as many eggs. So in IUI, we give very gentle stimulation with the same drugs which we use in IVF. I personally feel gonadotropins are so much better than clomiphene or tamoxifen or letrozole for patients undergoing IUI. When I talk about these 3 drugs, I would definitely like to give them in women who have anovulatory polycystic ovarian syndrome, where there is need of ovulation, and this need can be overcome by using clomiphene as the first line drug. If it doesn't work or the patient fails to get pregnant on that, then we go on gonadotropins. But when we're talking about IUI, which is generally for unexplained infertility, then I would like to use gonadotropins. And these women are women who are already ovulating. So clomiphene really is not required for inducing ovulation for these women. Yeah, there are a lot of changes in induction of ovulation for IVF. The conventional method of doing a long down regulation protocol is now converted into antagonist short protocol, and wherever we feel that the ovary is hyperstimulated, we can give an agonist trigger, especially we've used antagonist protocol. It becomes very safe for women, and we can preserve all embryos and transfer them in a subsequent cycle. So these are the major changes which have happened in a stimulation protocol, the use of antagonist protocol and the use of agonist trigger. Apart from this, there are long-acting gonadotropins which are coming up. Once the DCGI approves them, we would have just 1 injection in 7 days given to normal responders, and this would be a big revolution in the field of ovulation induction. Well, what I see is there is a trend towards everybody wanting to do IVF. I would want our young doctors to say, please don't get on to idea that IVF is very lucrative. It looks very lucrative, but you have to put in a lot of hard work and a lot of quality work to give results. So opening up an IVF center puts a lot of pressure on you to do unethical practices to recover the cost which you have put in to make that center. So I would suggest that all the youngsters get into good institutional centers to learn good practice points of IVF, and once you know that you can manage it very well, then only get into a private, have a private setup of IVF, or think of doing or opening up a center which has IVF. Don't make it a business, let it remain a science.